Picture this: you're living in ancient Mesopotamia, writhing in agony from an infected tooth. Your only hope, a local healer who genuinely believes tiny demons are feasting on your jaw from within. His cure involves pouring boiling oil mixed with beetle dung directly into your mouth while chanting prayers to ward off evil spirits. And here's the terrifying part: you're actually lucky if that's all he does. Welcome to the savage reality of ancient dentistry, where medical ignorance met desperate suffering in ways that would make modern horror movies look like children's tales. For millennia, humanity faced an impossible choice: endure teeth rotting in their skulls, or submit to treatments that killed patients more reliably than warfare. Long before humans understood bacteria or infection, every civilization developed its own terrifying explanation for dental pain. The Sumerians blamed it on divine punishment. Ancient Indians believed angry serpents lived in molars. But across cultures, one delusion reigned supreme: the toothworm theory. This wasn't merely a quaint misconception. It was a deadly belief that persisted for over 5,000 years. Healers worldwide genuinely thought microscopic serpents burrowed through teeth, creating cavities as they fed. The evidence seemed obvious. Teeth developed holes, and sometimes white nerve tissue resembled tiny worms when extracted. The treatments spawned from this theory were medieval torture disguised as medicine. Babylonian tablets from 1800 BCE describe fumigating mouths with henbane seed smoke, a hallucinogenic plant that caused seizures and respiratory failure. Patients would inhale toxic vapors until they collapsed, with healers declaring the worms successfully suffocated. Medieval Persian physicians prescribed even worse: mercury vapor baths for teeth. Patients would hold quicksilver in their mouths while heating it with candles, breathing poisonous fumes that destroyed brain tissue. Those who survived often suffered permanent tremors and madness, a condition they called the shaking cure. When prevention failed, extraction became inevitable. But in an age without anesthesia or antibiotics, pulling teeth was essentially battlefield surgery performed by amateurs. The practitioners were rarely medical professionals. Your local blacksmith might yank teeth between horseshoe fittings. Traveling merchants sold extraction services alongside vegetables. Even executioners moonlighted as tooth pullers, using the same tools for both professions. Their instruments were crude weapons barely modified for mouths. The tooth key resembled a corkscrew that literally twisted teeth from sockets, fracturing jaws in the process. The pelican tool got its name from its resemblance to the bird's beak, a hooked metal claw that crushed teeth while extracting them. Success meant survival, not healing. Ancient Greek medical texts casually mention that 1 in 3 extractions resulted in death within days. The lucky survivors often faced fractured jaws, permanent disfigurement, or deadly blood infections that spread to the heart. Archaeological evidence confirms these horrors. Mass graves near ancient marketplaces contain skulls showing botched extractions, teeth half removed, jaws shattered, bone infections that clearly preceded death. One Egyptian mummy showed evidence of dying mid-extraction. The bronze tool still lodged in her mandible after 3,000 years. Around 7000 BCE, the Indus Valley civilization pioneered something revolutionary yet revolting: dental drilling. Using bow drills, essentially fire-starting tools, they ground into teeth at roughly 1 mm per hour of continuous agony. The patient experience defied comprehension. Held down by multiple people, fully conscious, feeling every grinding rotation as flint or obsidian bits slowly pulverized tooth enamel. The friction generated extreme heat, literally cooking dental nerves. Sessions lasted hours. Many patients died from shock before completion. Egyptian improvements made things worse, not better. They discovered copper drills cut faster, but conducted heat more efficiently, intensifying the burning sensation. Their solution to cavity filling was equally barbaric: molten beeswax mixed with minerals poured directly into the drilled hole, cauterizing exposed nerves with temperatures exceeding 150 degrees Fahrenheit. Chinese dentists during the Tang dynasty attempted mechanical innovations, creating foot-powered treadle drills. These allowed faster drilling, but zero precision control. One account describes a patient whose tooth exploded from pressure, sending fragments into his throat and causing him to choke to death in the chair. Ancient oral hygiene practices often caused more damage than neglect would have. The Egyptian tooth powder recipe included crushed pumice, vinegar, and human ashes, abrasive enough to strip enamel completely within months of regular use. Roman dental care reached peak insanity with their obsession over whitening. Wealthy citizens gargled with human and animal urine, believing ammonia brightened teeth. They were technically correct. Ammonia does have whitening properties, but the practice spread diseases that killed thousands. Greek athletes chewed on leather soaked in bull's blood to strengthen teeth, inadvertently introducing countless pathogens directly into their bloodstreams. Spartans rubbed their teeth with iron filings to prove toughness, causing heavy metal poisoning and premature tooth loss. The Chinese Han Dynasty promoted tooth beetles, actual insects believed to eat away decay. Patients would hold live beetles in their mouths, allowing them to supposedly consume infected tissue. The beetles often carried parasites that caused far worse problems than cavities. Vanity drove ancient peoples to dental modifications that guaranteed lifelong suffering. The Mayans drilled precise holes in incisors to embed jade stones, a process requiring hours of agony that frequently resulted in fatal infections. Survivors faced exposed nerves that made eating torture and breathing painful. In Renaissance Italy, wealthy women had healthy teeth extracted to insert ivory replacements connected with gold wire. The constant pressure loosened surrounding teeth, eventually causing total tooth loss. Many died from resulting malnutrition, unable to properly chew food. Japanese tooth blackening, practiced for over 1,000 years, involved daily application of iron acetate that permanently stained teeth while causing severe periodontal disease. Users suffered chronic pain, foul breath that required constant perfuming, and eventual tooth loss from weakened enamel. Perhaps most shocking was the economic exploitation. Ancient tooth pullers charged astronomical fees, knowing desperate patients would pay anything for relief. Roman records show dental procedures costing more than slaves, with payment required regardless of survival. Fraudulent practitioners thrived on ignorance. They staged elaborate demonstrations of removing toothworms, actually hidden threads, or actual worms palmed during procedures. Others sold miracle cures containing toxic substances like lead and arsenic, creating new problems while ignoring real ones. Social consequences proved equally devastating. Missing teeth meant unmarriageable daughters, unemployable sons, and social isolation. Speech impediments from dental damage marked victims as cursed or diseased. Many chose death over living with visible dental problems. Ancient dentistry wasn't medicine. It was organized suffering that killed more effectively than most diseases. Conservative estimates suggest millions died from dental procedures that had virtually zero success rates. Every extraction risked fatal sepsis. Every drilling invited deadly infection. Every cosmetic modification shortened lifespans dramatically. The tools evolved, but the ignorance remained constant. From stone drills to metal implements, from herbal poisons to chemical burns, each civilization added new layers of horror to dental treatment. The only consistent element was pain, overwhelming, inescapable agony that drove rational people to accept probable death over certain suffering. Today's dental anxiety seems almost quaint compared to historical reality. We complain about mild discomfort while sitting in sterile environments with precision tools and effective anesthesia. Our ancestors faced butchers with pliers, no pain relief, and infection rates approaching certainty. The next time you postpone a dental appointment, remember that you're reliving in the first generation in human history where dentistry actually helps rather than harms, where tooth problems don't mean choosing between agony and death, where a simple cavity doesn't require red-hot metal or toxic fumigation. Ancient dentistry's greatest contribution was untenning technique or tool. It was showing future generations exactly what not to do. Every modern dental innovation exists because we learn from thousands of years of unnecessary suffering. In that context, even a root canal seems like a blessing. The horrors of ancient dentistry remind us that medical progress isn't just about advancing technology, it's about abandoning dangerous ignorance. Our ancestors suffered so we don't have to, turning dentistry from deadly torture into actual healthcare.